Hi everyone. I'd like to start out by thanking Yana for inviting me to speak on this panel. I'd really hoped to be there in person, but the opportunity to speak about competencies for wellness promotion is still exciting. Feel free to reach out to me via email with any questions or feedback that you have on the presentation. My name is Christina Peterson, and I've been studying wellness promotion competencies for a few years now. I currently work as an evaluator and data analyst for the University of Tennessee, but I've done a lot of work with the National Wellness Institute in the past. Wellness promotion practice continues to evolve and offers a unique contribution towards creating the conditions needed to progress toward realizing full potential, both at the individual and collective levels. Yet, what we're realizing is that the terms wellness promotion and wellness practitioner remain ambiguous, and there's little agreement on the scope of practice or how wellness practitioners differ professionally from other health and human service professionals. And so thinking about this, we really realized there was a need for wellness promotion competencies to help clarify what the role of a wellness practitioner really is. Competencies can provide a framework for developing talent and driving success. They offer guidance for both current roles and future directions in the field. And so competencies really summarize the skills, knowledge, attitudes, abilities, and ethics of a profession, and thus provide a unifying framework for educating students, training practitioners, and hiring qualified employees. So in 2015, in collaboration with the National Wellness Institute and Yana, I began studying what made wellness promotion professionals effective in their roles. And so we started the study kind of from a place of defining wellness. And so the National Wellness Institute defines wellness as an active process through which people become aware of and make choices toward a more successful existence. And so then thinking about a wellness practitioner, we conceptualized this as any individual whose main professional role supports individuals or groups in this process of becoming aware of and making choices toward a more successful existence. And so our research then into wellness promotion competencies has really focused on self-identified wellness practitioners who are affiliated with the National Wellness Institute. And this first competency model emerged after about 2 years of key informant interviews, a survey of wellness professionals in the United States, an expert panel review, and NWI, or National Wellness Institute, member feedback. So results of these key informant interviews are also published in an article, Characteristics of Effective Wellness Practitioners, which is linked in the final slide if you wanted to read more on this process. The first version of wellness promotion competencies included 28 items organized into 5 domains. And these domains included the systems aspects, methodological aspects, contextual, project management, and professional aspects. The wellness promotion competency model received a lot of positive feedback and helped move the wellness field forward towards a more unified understanding of wellness promotion practice. But about 5 years later, so 2020, NWI and I collaborated on a follow-up study to investigate the factor structure and measurement properties of the model. So in this study, we sent out an online survey to NWI members asking them to assess their own self-efficacy in each of the 28 competency items. Self-efficacy refers to an individual's belief in his or her capacity to execute behaviors necessary to produce a specific performance outcome. And so we felt that this was an appropriate way to measure someone's own self-assessment of their wellness promotion competencies. So self-efficacy also kind of reflects this confidence in our own ability to exert control over our motivation, behavior, and social environment. We used a 5-point response set to measure wellness professionals' personal self-efficacy on each of these 28 items, and then conducted a factor analysis which supported a 5-domain structure. However, each individual competency item loaded slightly differently onto the factors than was originally proposed in the initial model. Since the items grouped together differently, we went through a process of renaming these factors to better reflect how the items clustered together. And we came up with a whole person and systems approaches domain, inclusive and responsive practices, authenticity and self-awareness, legal and ethical principles, and communication and connection. And we've received some initial feedback on the model that suggests wellness professionals feel that these domains better reflect kind of that sentiment of wellness promotion that they feel, which was an improvement upon the last competency model. Items that loaded weakly onto these factors were reviewed by an NWI expert panel to revise wording, because we got the sense that some of the items were not clear or well understood by respondents. And so the new competency model reflects some of the updated wording as well as domain clustering that we changed in the revised model. And then our goal moving forward is to continue studying variation in competency difficulty and measurement properties across different subgroups. And we hope that this continued improvement improves the utility of this model for curriculum design, certification, and professional development in the wellness field. So I've put a couple of links here to references on the work that we've done so far on the Wellness Promotion Competency Model, as well as a link directly to the National Wellness Institute's description of the model on their website. And so I'm going to turn it over to Jana now to talk about how the Wellness Promotion Competency Model might apply to the Czech wellness promotion context. And like I said, feel free to reach out to me with any questions or comments on the presentation. And thank you very much.